first section is essential supplies for birth. So we're going to learn what kinds of things that you need. Birth is a natural process, yet we need some basic supplies to make it safer. In this section, we will show you what supplies to gather and how to use them.
Good morning. It's a beautiful morning here. It's going to be a very warm day, and we are going to be stuck inside, but I hope it'll be worth your effort to be here. I need to make a disclaimer first. The information in this class and the CD that is going out is not intended to take the place of a competent midwife or physician, nor does it imply that a mother should deliver without a midwife or other medical help. It is intended to assist in the event of an actual emergency situation, which could occur at any time and any place. During a blackout, a natural disaster, we're waiting for an earthquake here in Utah, a nuclear fallout, a snowstorm, a vehicle failure, an economic collapse, or simply when the baby is coming too fast. And I have been a midwife for 35 years, and by this time, I am quite opinionated, let's face it, okay? But my opinions may not all be correct, okay? And as you go through and have experience in childbirth, you will develop what you think needs to be done. You can draw on inspiration and help. I can't think of anything else that you could get more inspiration and help with than delivering a baby. And in other words, you have to kind of follow your own intuition in the situation and what needs to be done. We're going to talk about basic skills that you need to know and things you need to be thinking about and what to do. But as I say, it is, there is no one way to do anything, okay? And the more you understand the physical body and natural things of helping women, the myriads of different options you will think of. Well, let's try this. Oh, well, what about this? So, in other words, this is really an important thing to do. And my daughter is here today, Riley, you'll probably see her. She is my baby, okay? I had her when I was 45 years old, and at the time I thought, you know, wouldn't it be wonderful to have a daughter that would help me in my old age go out to births? And a couple of years ago, she came home and said, Mom, you know, I'd kind of like to go out on births with you. And she is completing her training and has a really good sense of what needs to be done. I would like to hand these out. I don't have quite enough. A little thing on the emergency childbirth, and it is emergency birth. I have to put an ing on this. If you go to this website, you can download a 16-page emergency childbirth folder. And you want to, this is what it is. And there's a couple things that I need to correct on this. One is I need to put down here, get a free copy and put the website down there. If you would, when you finish this class, a good thing for you to do would be to make an extra copy of this and go down to your local emergency preparedness, usually the fire station, the fire chief. Give them a copy with written down here, get your free copy at da-da-da-da-da. So, and tell them that you just took a class on emergency childbirth at the School of Health Freedom, okay? And let them know that these things are going on, and find out who is the main preparedness person in this area. I know in our little city, Pleasant Grove, we have a lot of preparedness activities going on, which is comes out of the fire and the police department, and the neighborhoods are all organized, and my husband and I are in charge of a couple blocks around our house. And I think that these things are really important for neighborhoods to get together and discuss, well, what do we need in certain situations? And so, whatever. Now, the reason why the first thing that I have on the list to teach you about essential supplies is the fact that there are a few things that you need in order to facilitate a safe birth. Now, the first thing is something to dry the baby off with. You actually need some towels, and you need a couple towels, okay? One to put over the baby when it's born and dry it off, and be sure you dry the head because that is where the baby loses a lot of moisture. Dry it off, and then what about this towel? It's wet, isn't it? It's moist, and it's going to keep the moisture on the baby, and the baby is not going to do as well. And so you have a second towel, and you put over the baby. Now, the reason I use a towel is because it does soak up moisture really fast, and it also is a little rough, okay? And so you can stimulate the baby's skin and with the towel. Now, any woman who is pregnant, okay, and let's say she's going to the hospital, she should make sure that she's got at least 2 towels on her lap, okay, while she tries to get there, because you never know what is going to happen before she makes it in the door of the hospital, okay? Always 2 towels. So if you have any friend, if you have anyone in your family that's pregnant and they're planning on going to the hospital or a birthing center, you say, make sure you have a couple towels with you when you go, because you never know what's going to happen, okay? The second thing is something to clamp the cord with. And I have little cord clamps. You'll see them later, okay? Little cord clamps, but I think you need to have 3 umbilical cord clamps. And you'd say, why 3? If you have the rare problem of the cord around the neck, okay, that when the baby comes out, I gotta get his head right, that it's too tight and the baby cannot be born, you are going to have to clamp it and cut between it. Now, I thought, I was thinking last night, how often does this happen in my practice? And, you know, most cords you can pull off, okay? Because 1/4 of all babies are going to have cord around their neck. So 25%, okay, are going to have a cord. And they've been having cords around the neck for centuries, okay? It's no big deal. But usually you can pull it and it'll go over. So there's 3 different ways to deliver a baby if the baby has a cord around the neck. Okay. The head has just come out, okay? And it's like this. So you take your hands and go up over the top of the neck and see if you can find a cord. If the cord is there, you pull it and stretch it. It's kind of elastic, and you can pull it pretty hard, okay, to pull it over the head and then deliver the baby. The second way is this, okay? So the head comes out and there's a cord, but I can't get it over the head. I can get it about like this, okay? So what you do is you keep the head next to the mother's leg, okay, because it's right there, and you flip the baby out like a fish, and you keep the baby's head next to the mother's leg. So it's like a fish. they're real slick and wet, okay, and you can get the body out and it kind of flip it around like this, okay. You don't want to pull it out like this because you could strangle the baby, okay, and so that could be a problem. The third way is you come right here and you get it and it's too tight. You're going to have to clamp it and cut between it. Unwrap it and then let the baby out. Now, let me see. I would say about 1 in every 50 babies have a real tight cord. Maybe a little bit more. But it is often enough that you should know what to do and have the supplies to do it. Now, I use hemostats, big hemostats on the cord to just go like this and then cut between it. But if you don't have all the midwifery supplies and so forth, you can do it perfectly with 2 cord clamps and a scalpel, okay, a sterile scalpel. You've got them right there, and so you clamp it twice, cut between it, whatever. Now, you know that as soon as you clamp that cord, the oxygen supply to the baby is gone, okay? And so that's why you want the clamps. Now, I grew up in the hippie age. I'm still a hippie, let's face it, okay? But at that, in that day and age, people were having their babies and then using shoelaces to tie the umbilical cord. A shoelace is not the best thing because it's a little too thick, okay? And then some people were using dental floss to tie the cord off. And dental floss cuts the cord. It's too sharp. You could use cotton string. So in your storage, it might be good for you to get a nice roll of cotton string. Nylon will not work because it'll slip on you, okay? But if you're tying the cord off and you have to do a square knot, so you have to do 2 knots, and then you go and tie the other one off, it is going to take a lot longer than using a cord clamp. But if the string is all you have, you should have 2 people. If you have 2 people there, have 2 people do it at the same time, okay? So that you can get it done as quick as possible. Remember, time is of essence as soon as you clamp that cord, okay? Now, using a string or they have actually cotton, special cotton, it's kind of like twine that they use for tying off the umbilicus. If the baby is born and there's no problem whatsoever, then that would be a good time. You can use that to tie off the cord. But as I say, in an emergency situation, use your cord clamps. And if you just have a few cord clamps and you're in the middle of a big disaster and you know you're going to have to go out to a lot of births, if the lady doesn't need the cord clamps, tying it off might be the best choice. But it might be good for you to have a bunch of cord clamps in your storage, okay? You can buy them. Our website is sunstoneformulas.com, so you can get them off of there. So, okay, what have we talked about so far? We need something to dry the baby off, to keep the baby warm. We need something to clamp the cord. Then we need something sterile to cut the cord with, okay? In an emergency situation, if you've got a scalpel in your kit or whatever, that works good. If not, any kind of scissor will work. but you need to sterilize it. So you could sterilize it.
These can be sterilized. There's scissors and scalpels.
Yes. Tasha has these wonderful little kits, okay? And we will talk more about them, okay? They are surgical kits, and they have scissors, tweezers, scalpel blades, and these scalpels can be used over and over again. They're not disposable, okay? I think if you do have a disposable scalpel and you're in the middle of whatever, then I would just boil it if it doesn't crink on you. Do you know what I mean? Whatever. But this is wonderful. And what is it, $30?
Yeah.
$30? Good price, okay?
Is that the same with the cord clamps? Can they be re-sterilized? They're not a one-time use item, are they? The cord clamps?
They really are one-time use.
Oh, they are.
They are one-time use. You can get stainless steel umbilical cord clamps that can be used over again, but I don't know where to get them, and they're pokey. In other words, they tend to poke the baby more than the plastic ones. If you were real gentle, you can take a knife where the cord clamp comes together and you can go like this and it'll open it. You might be able to reuse it, but generally speaking, no. Okay, now, it is very important to understand that there is no real rush on cutting the cord. In fact, you'd like it to stay pulsing for quite a while, unless you have that one particular problem of real tight cord around the neck. You want the oxygen going into the baby for as long as you can, especially if you have to resuscitate a baby. That is really helpful. You could, if the baby came too fast and so forth, and you didn't have things sterilized, okay, you can just put the placenta in a bag, okay, and then you can run and go sterilize your stuff, and then when you get that done, then you can clamp and sever the cord. And if you have string, you need to sterilize that also. You could sterilize it with the scissors. Just stick it in the water and boil it for 15 minutes or whatever you're going to do. The fourth thing that you really need is something to suction the baby with, okay? These days, suctioning is not really thought of too highly. In other words, a lot of people think that it is disruptive to the baby to suction it and so forth. But if the baby really has something stuck in its throat, or if the baby has had a bowel movement and has meconium in the mouth and so forth, really suctioning is really important. You are helping the baby out. Now, what hospitals generally give moms before they leave is a 2-ounce bulb syringe. This is a 3-ounce. A 3-ounce bulb syringe is extremely important to have because it's got a stronger pull. In the hospital, they have DeLees and suctioners that they can suction the baby with, but you would not probably have that. And so a 3-ounce bulb syringe will do you really a good job. Riley was just out to a birth a couple weeks ago with another midwife, and she said, "You cannot believe what one suction came out of the nose of the baby." He said, it was so clogged the baby couldn't breathe through the nose, and you want the baby to be able to breathe that way. Now, when you use the bulb syringe, you push it in outside the baby's mouth. You insert it in the baby's mouth to the side, okay? And then you let go and so forth. You don't want to put the bulb syringe straight down because it's going to cause the baby to gag. The gag reflex, and it's going to stop breathing. Now, the baby will start again, but it's better to do it the side. You can definitely over suction, but if the baby is bubbling all over the place or whatever, it's going to be obvious that the baby needs to be suctioned. So this is important. The next thing I have on this list is something to keep the baby warm with. Now, you're going to need, you can put the baby right on the mother and cover him up, but if it's out somewhere You want to have, you know, a diaper or whatever. You want to have an infant hat or gown or a blanket that you could put the baby in. Another thing is 3 plastic bags. In this process of making up just an emergency kit, in other words, you're making up just an emergency kit, you want 3 plastic bags, 1 to put under the mother before she gives birth, and 1 to gather up garbage, whatever. A gallon Ziploc bag for the placenta. I have under here 4 under pads, some pads to put under her, a couple pairs of exam gloves. I get my gloves at Costco. I'm going to do some advertising here. But if you have some bags, and I think that this is really good to have in your storage, okay? But if you take out the whole bag, don't open the front, because it just open the side and pull out the ones that have the cuff on them, okay? Because they're going to be half cuff and half fingers, okay? And I like to take the bags and put about 25 in, put on a pair of gloves, okay? Open up a quart freezer bag, okay, and put about 25 in them. And disperse the gloves so that you have them in bags, which are handier than this, because then you can put a bag in your pocket, okay, when you're at the birth or whatever, and you have them together. If you have some kind of lubricating stuff or some olive oil, or you might want to put in your pack some flexible straws so the woman can drink while she's laying down, and an adult diaper or 2. Now, I advise any parent who is pregnant by the last 2 months of their pregnancy to put together an emergency little kit with these things that we've just talked about and put it in the back of their car. If they have it in the back of the car and something goes really fast, okay, they won't be spending their time running around trying to get things or get whatever they need to have. They will have it in one place and be able to take it and use it, okay? And things will go a lot more smoothly, and the mother will be more calm. I don't know about you, but you see, I've always been interested in emergency childbirth from years ago. Even when I started my midwifery practice, you know, 30 years ago, I used to go out at that time and teach emergency childbirth. But I always watch on the Yahoo News or whatever, because I'm on Yahoo, when the story comes up. Now, I'm going to read this little story that was on Yahoo News, and then I want you to tell me something that was incorrect, okay? A couple speeding down the highway at 100 miles per hour because the wife was in labor didn't reach the hospital in time, so the father had no choice but to deliver the baby on his own. On Thursday, Linda Morris, 36, began to feel hard contractions. The stay-at-home mother from Greenfield, Missouri, had experienced false labor the day before, so she wasn't too concerned. However, that night, while she and her husband, Heath, were lying in bed, the cramping got worse. We didn't want to leave for the hospital until her water broke. Bad mistake. And so, well, maybe it is a good thing. And so, we were just watching and waiting. Heath Morris, 35, tells Yahoo Shine. Linda's water broke at 1:30. After calling Heath's mother to watch their 3 children, age 15, 11, and 2, the couple grabbed their pre-packed overnight bag and headed to Cox South Hospital in Springfield. In their pre-packed bag, they should have had a couple towels. Okay. They raced down James River Freeway, and when they were just 3 blocks from the hospital, the baby decided to arrive. I wrapped him up in my t-shirt and handed him to my wife, he said. Afterwards, Heath called 911, and the operator advised him to tie the umbilical cord with whatever instrument he had handy. Well, the only thing in the car was my son's MP3 player, so I ripped off the earbuds and tied the end of the umbilical cord, he said. I couldn't believe what I was using, but it was the only thing I had. The ambulance arrived 5 minutes later. The doctors were so amazed that I delivered the baby that they asked me if I wanted a job at the hospital, he said. Still shirtless and freezing, Heath rummaged through the overnight bag to find another shirt. I threw the first thing on I could find, and my wife said, "Look what your shirt says." The shirt said, "Dad rocks." I guess that's fitting. Okay, what was something that wasn't really correct in this?
He didn't need to tie off the umbilical cord.
What?
He didn't really need to tie off the umbilical cord.
He didn't really?
Even if he did, he only did it once. He didn't do it between the mother and the baby.
Yeah. Didn't need to do that, okay? And it was something non-sterile, okay? And actually, infection gets into the baby the quickest through the umbilical cord. So that is something that you need to be really careful about, okay? And anyway, he did a good job. Now, there are a couple different scenarios that we're going to talk about. One is really fast delivery, like this one, okay? And we're going to talk about that first. And then we're going to talk about the scenario where, you know, there's just no possibility of going to a hospital or anyone to come to help them, and you're going to need to take care of the whole ball and wax, okay? But this concludes this section.